Hello, I'm Dr. Athre. This video is a brief primer about the aftercare and post-operative instructions after a rhinoplasty. Please keep in mind, some of the things that I'm discussing here today are specific to my patients, and each surgeon has a very unique set of post-operative instructions. Rhinoplasty in any surgical procedure is part art, part science, and therefore most surgeons have a unique set of post-operative instructions in order to maximize the surgical outcome. I would like to just briefly describe some of the post-operative instructions that I instruct my patients, and hopefully that will answer some questions for the viewers out there. After a rhinoplasty, there are several incisions that have been made, some inside the nose and some on the outside of the nose. In generality, a rhinoplasty consists of modification of both cartilage as well as bone. Therefore, the post-operative care and the dressings after a rhinoplasty are concordant with this. In my hands, I usually use some degree of packing in the nose. Some of the other options that I've seen surgeons use include Doyle splints, which are small plastic splints, and some surgeons actually use no packing. I find in generality that the packing minimizes the amount of swelling post-operatively and acts somewhat like a tampon in absorbing some of the blood immediately post-operatively and stopping that bleeding in a quicker fashion. So a standard post-operative nasal dressing with respect to my patients includes packing on the inside of the nose, approximately 4 inches, with Band-Aid looking strips that go across the nose called steri strips, followed by a custom molded splint that goes over the top. Now, most surgeons use some variation of what I have described here for their rhinoplasty patients. Most surgeons use some degree of deep IV sedation versus general anesthesia for these patients as well. I prefer general anesthesia for all of my rhinoplasty patients. So when a patient goes home after surgery, I tell my patients to first start oral intake with some Gatorade or Sprite first. Do not try to have a steak dinner as your first meal after general anesthesia. It will induce nausea and vomiting, and then starts a vicious cycle of nausea and vomiting. Rhinoplasty patients, as they are at slightly higher risk of nausea and vomiting due to the fact that they have some amount of blood that trickles behind their nose into their stomach, thereby irritating their stomach. Therefore, it's very important to start with a bland, simple diet in order to minimize the chance of starting the cyclical nausea-vomiting cascade. If a patient can tolerate the Gatorade and Sprite without any problems, I tell them to progress to something like soup or pudding, and if they can do that all right, then they can eat whatever they feel like eating. There are numerous instructions about lying down versus sitting up and all of these various confusions. In generality, it is useful to have the patient slightly propped up post-operatively. This minimizes the amount of drainage through the back of the throat and down into the stomach, and also keeps the head elevated above the level of the heart to minimize bruising and swelling. However, I do feel in my hands that it is most important that the patient is comfortable and is able to rest comfortably. So if a patient is suffering from back pain or other issues from being propped up, I try and have them lean down as much as they can in order to be comfortable. The dressings normally stay in place anywhere from 4 to 7 days. I tell my patients that they can shower from the neck down the day after surgery, use a washcloth for their face, but do not get the nasal area wet until they tell them to do so. Normally this is on the morning of the day that we are going to remove the dressings so that the dressings can be removed a little bit more easily. In terms of physical activity, I tell my patients to start with daily normal physical activity 24 to 48 hours after surgery. I prefer my patients to continue walking and moving around, thereby minimizing the chance of having serious complications such as DVTs and blood clots in extremities, but also gives them a little bit more positive energy so that they heal quicker and faster. Once the dressings have been removed, I examine the patients on the post-operative appointment and also clear them for further physical activity. Questions that patients should ask their doctors: when can I exercise? When can I return to complete normal activity? Is it all right to get the incisions wet? Do you recommend any type of wound care for the incisions? I hope I've given the viewers some basic information with respect to postoperative rhinoplasty care, as well as some important questions to ask your surgeon. Thank you very much.